I'm Dr. Angie Stamm.
And I'm Kayla McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to Integrative Connections. I'm Dr. Angie Stamm, and today we are chatting with Katerina Greco, who is a close personal friend and former employee who has been on quite an interesting health journey herself and has learned a lot of lessons with regard to navigating the health system in terms of patient advocacy and having to fight for getting answers. And so we wanted to have a conversation today about patient advocacy, basically with regard to people and animals in, navigating the healthcare system, which can be quite challenging, especially when it comes to putting together Western and integrative pieces of the medical system in particular. So welcome.
Thank you. I'm so happy to be here. I've loved all the work you've done. I remember being in your practice and seeing all the pets you've helped, and it was so cool to see just pets' lives transform and them come back to health.
Thank you.
Yeah, and so I've had a similar journey myself. My health problems started about 13 years old. I had a vaccine reaction, and after that I struggled with really severe nausea and pain for about 2 years. And
it was that MMR vaccine that you got at what age?
13.
13?
13.
And you got that for a school requirement?
Yeah, it was a school requirement, and I'd actually never received it before. I'd received just the measles vaccine, not the MMR.
Okay.
That was my first one, and I had that reaction to it.
And your family has a lot of genetic detox pathway challenges.
Exactly.
Which we now found out.
We now know.
So, oopsie.
Oopsies, that didn't go well.
So that triggered a whole cascade of what we now know. We'll go ahead. Yeah. Autoimmune, collagen dysfunction, which broke down the ligaments attaching your C1 to your skull.
Yes. And so that was a whole mess. And
how do they know that that's really what happened? I mean, how do we know that?
We can't be for certain. Speaking with the neurosurgeon I did end up using for my neck problems, he did, talk about vaccine reactions being something that has triggered his patients' problems.
And you ended up going to one of the top neurologists in the country for this particular condition, right?
Yes, I ended up
in New York.
Yeah, I went over to New York, and I had a C0 through 2 fusion. So the base of my skull now is fully fused, so I thankfully can, hold my head upright and be healthy.
Now you can get out of bed and not pee your pants.
Exactly. So that's wonderful. And yeah.
But you literally would have died had you let Kaiser navigate your healthcare.
Exactly.
Because they were like, sorry, we can't help you.
They did. They literally said that.
So you had to go down this whole rabbit hole of getting a diagnosis and then finding the right practitioner and finding the right surgeon. And so that whole process was about how long from like onset of symptoms to getting your surgery and now you're recovering? Like it was like a 5-year span, right?
Yeah, or even longer. Like when I first had those symptoms develop, they were they impacted my life a lot. Like I was nauseous all the time and, vomiting multiple times a day at that point. For about 2 years, that was the case. And
the nausea was just from the nerve compression?
That's what they think now, because since my surgery, I have not really struggled with nausea at all.
It's crazy.
Yeah, I know.
It makes me think about all of my dogs and cats that have chronic vomiting. I wonder how much of that is just chiropractic issues.
It'd be interesting to see if chiropractic helps. I actually found acupuncture was what helped at that time, though. Okay. I had acupuncture like once or twice a week for about 2 years because of just finding it was so helpful. Cool. And I loved it. I actually considered going into Chinese medicine as a profession.
Yeah. And so the name of the condition is CCI, right?
Craniocervical instability. And
it can be a range of obviously severity. Some people have it very mildly and they just have like low energy or chronic headaches and such.
Exactly. So
it can go all the way to like full paralysis.
Or even like if it's bad enough, like you can literally be internally decapitated.
Oh, you can actually like
yeah. And you think everyone would die if you're internally decapitated, right?
Right.
But there is a small percentage of people that are internally decapitated that survive and even return to almost complete normal function.
So their head literally has no attachment.
I mean, they have to fix it.
But like your skull can literally be just held on by your muscles.
Yep. That usually is like car accidents, like very severe car accidents.
That's horrible.
There are cases of kids. It's usually kids. Like adults don't have the healing abilities in their body at that point usually to fully recover from something as traumatic as that.
Okay.
Yeah, kids can sometimes, it can be from literally like full-blown paralysis, you know, very, very severe bedbound, unable to move.
Wow.
Tons of neurological symptoms to rather mild, like it can just cause some headaches, some
Fatigue,
like
not feeling great,
to, you know, much more severe problems. Wow. I was more in the middle, leaning towards the severe side.
Yeah.
But yeah, it was after that vaccine, there's about those 2 years where I was severely, you know, affected by nausea and pain. And then...
And the pain was where?
Mostly my hands and joints and also my back. I later found out that I had tethered cord syndrome, which is the phylum on the bottom of the spinal cord. In my case, it was too thick. And so I was born that way. And then as I grew, I had less, my spinal column was longer because I was taller. And so instead of being tethered to the bottom and having, wasn't as stretched. And so as I grew, it became more and more stretched.
And that's a separate issue.
Separate, but related too, because the spine as a whole affects your nervous system, and your nervous system affects your whole body, which is what I found. I had so many secondary health problems. Like I had a list of probably 30 diagnoses, and really all of them went away after my back and neck were fixed.
Amazing.
Yeah.
Amazing. I just remember you going through in your earlier stages before you had a diagnosis, having to really push and advocate and try to find answers because you weren't getting them from the like first and second and third opinions. So what was that like? And how did you and your family navigate that?
At around 16, I became really ill. I had an infection and I went like really downhill. I went from being in school full time, being an athlete. I was showing horses and I was riding about like 10 horses a day. And very quickly, within about 6 weeks, I went from doing that to housebound, then even bedbound about like 2 months later. And at that point, I had been seeing doctors and they were like, we don't know, like, maybe there's some minor stuff. Maybe you have adrenal fatigue.
They thought maybe you had Lyme's. I remember for a while they were like,
a little bit later, but yeah, like at first they were like, you're vitamin D deficient. I'm like, that's not what this is. And so I eventually was diagnosed with chronic fatigue syndrome, and that was kind of a starting point of like, where do I start to look?
Okay.
And so
that's just a symptom of something.
Yeah, that's not a root cause diagnosis. Right. And I had been told that I would likely, be disabled and bedbound for life. And I wasn't willing to accept that. I wanted to live a full and wonderful life. And so I started looking for specialists and figured if I could find someone who understood the disorder and understood some of the root causes, I could go from there. And so I had
And this was really like you doing a lot of your own research.
Yeah.
Yeah. I mean, your parents helped.
Exactly.
But you were really the driver.
I was the driver. Yeah. I had really I knew that I needed more.
You were like on a mission.
I was on a mission. I was like, I am not staying this way. So there was a book by Dr. Judy Mikovits, I believe is how you say her last name. And it talked about a doctor who's in Nevada. I forget his name now.
Schallenberger?
No, it's an Incline Village. Forgetting his name. But my mom had called his clinic and was asking about getting in. They had about a 5-year wait list. And
I remember that.
That's not going to work.
She's going to be dead.
Yeah, that's not going to work, you guys. And so the receptionist was super sweet and gave my mom a whole list of specialists that might have openings. And so at that point, one of the doctors on the list, he did not have openings himself, but he had recently brought a new doctor into his practice to train. And so he's like,
And what specialty was that?
They specialized in chronic fatigue syndrome, but more complex illness. So illness with multiple factors, multiple conditions, which was what was really helpful for me, having someone that can specialize in kind of a cluster of problems. A lot of the times, like there's the elephant analogy. If you're looking at, the tail, you're going to think it's this. If you're looking at the tusk, you're going to think it's this. But to have someone back up and view your health as a whole picture is extremely helpful.
Sure.
I think that's one part for advocacy, is if you can have a doctor who is able to step back and look at the picture as a whole, you can then start to get to root cause, which is the whole way you can get better. Like that is, integrative, functional, no matter what medical system you look at, that is the way to get better usually. And so from there, I spoke with her, and she brought up something that I hadn't realized the importance of when advocating for myself until that point, which is organizing. She was such a big advocate for organizing. She had me create a binder. It's about like a 2-inch binder that had every lab test, every doctor's note, everything that had been tested in my home. So like home water tests, home mold testing, literally everything all in one binder.
Wow.
And her belief behind that is if you could have that for her and for any other specialist that you're seeing, they would then have access to all the information needed. And so that was one piece that was extremely helpful. And then she also asked for a spreadsheet with all supplements and medications I was currently taking and also had taken previously.
Wow.
Which is a lot of work. And it's a lot. When you're not doing well, that's usually a pretty long list.
Yeah.
I did find later down the line, though, that spreadsheet was so helpful because I went to a doctor and he drew up a whole treatment plan. And then I was like, oh, I think I might have tried these. And we looked at my spreadsheet. He had recommended about 20 supplements, and I had tried every single one for like longer term.
But you had forgotten?
Yeah, I just didn't remember off the, and I'm like, but based off of the spreadsheet, I saved all that time. Just having that was really helpful for developing treatment plans. And then the other thing for organization that she recommended was a chronological timeline of your health and even life history. And so that can start with like in utero. My mom was pregnant with me while she lived in a moldy home. And so mycotoxins can be, or suspected to be, passed in utero too. So there was that, and then, birth history, and then anything like from when you started walking. Did you walk before you crawled? Like literally developmental. And then going on into later years, when did symptoms start? What triggered them? What treatments did you do? Did you start a certain treatment that drastically changed things? So at this point, I have a timeline that's about 20 pages long, and that was extremely helpful, like when I did see the neurosurgeon, because he highlighted things like there was, it was even more embarrassing, but the symptom isn't embarrassing, but I used to have trouble holding my head up when I was tired, which was related to my neck problem. But I used to think it was normal, and I tried convincing myself that was normal.
Oh, wow.
Like, oh, you're tired, you're not supposed to be able to hold your head up. And that's another important thing, like when you're advocating for yourself, trying to be objective and understanding what is important for the doctor to know, and also what is normal, especially if you got sick younger, or if it's a puppy and you're like, the puppy's always been that way, but is that actually normal? Is the puppy actually supposed to be that way? And like in my case, like no matter how tired you are supposed to be able to hold your head up. And so I put that on there at one point. There was a point when I was like, I am having trouble holding my head up when I'm tired. It started about this date.
Oh, interesting.
The neurosurgeon highlighted that. You should see his highlights. He was like, that is not good. I'm like, yeah, I know now. I'm like, I'll admit it. That's not good. So yeah, that timeline can be really helpful though. And
Sure.
It can allow them to pinpoint the root causes. And did you move and then you got sick?
Yeah.
That could lead to them checking out environmental causes, testing your water. Are you being exposed to heavy metals? Testing your home for mold. Checking for, EMFs. There's so many things that could lead to. And so having that written out can be a great starting point for a doctor to understand your root causes.
Sure.
In addition, like having a clear outline of any symptoms and even organizing that if there's certain clusters of symptoms that seem to flare up at the same time. I struggle with something called mast cell activation syndrome, and so sometimes I'll have reactions and then I'll have a whole bunch of weird symptoms, and understanding that those symptoms are related helped with the diagnosis. And thankfully it doesn't affect me too much today, but that's, was hard to pinpoint. It was,
but it's just like putting a puzzle together.
Exactly.
And these complex illnesses.
And if you know which pieces go together or closer to each other, it can kind of help put the whole picture together.
Sure.
So,
yeah, that's great. I think that's great. And I
part's
think that can be
key.
carry over into the veterinary world too.
For
Pet
sure.
owners can, I have some clients who are very detail oriented and use a lot of supplements and complex diets, and they have it all written out for me, and it saves so much time.
For sure. I remember when I worked at your vet office, I was like, oh my gosh.
Some of these people are like,
People have it all together. It reminded me of me. I was like, oh my gosh, like, good for you. And it was helpful.
Super, yeah.
Some of them, like their pets have a complex history. They have a lot going on, and they're not necessarily...
the doctor's going to miss things.
Exactly. Like things will be missed, and because it's understanding what's important and what's not, and presenting that in a way that the doctor can easily understand and read, or the vet. Like that does apply to pets too.
Sure.
You are your pet's advocate, and you have to take care of them.
Absolutely. Yeah.
What do you feel like is helpful for like pet parents to do to advocate for their pet?
I think having their goals in mind, and being able to clearly communicate what their goals are for their pet is super helpful for me as their care provider, so that I know, especially in an integrative space where we have even more tools in our toolbox than a traditional veterinarian. We're still general practice, but so are they just in a palliative mode where they don't want to do a bunch of diagnostics? They just want to focus on comfort and quality of life? Do they have pet insurance and they're dealing with a young animal with something that they want to go full blast on diagnostics, right? Do they not want to use any Western medicines, pharmaceuticals? They just want to go all natural. So just having a clear picture in their mind about which direction really helps us customize the care and be succinct with it and practical with it.
I love that. I know I've struggled with certain practitioners of, being overly Western or only wanting to use supplements. And I think, as a patient or as a client with a pet, being able to name kind of where on that scale you feel comfortable can really help your doctor or your vet land where you need them to.
Yeah, absolutely.
Awesome. Yeah. Another thing would be, talking about advocating for yourself with doctors, is they are, educated, they have so much experience and knowledge, but they aren't the dictator of your life. I think a lot of the times we take what they say very seriously, which is great and important in some scenarios. Mm-hmm. But sometimes they aren't correct.
Correct.
Sometimes there's misdiagnoses, and sometimes you're gaslit and ignored, and taking the authority to make the decisions that are right for you in your own life, and to look at the situation and go, do I need another opinion? You have the ability to do that. It is your pet, it is your health, and that can go a long way. I know the amount of doctors I have seen is probably more than most people will see in their lifetime, but being able to make those decisions was really what helped me get better. I think if I had given my health over to a doctor to manage, I would still be sick, because so many doctors just don't understand what's going on, and some of them don't have the knowledge to help you, and sometimes you might need to see multiple doctors. And beyond just finding the appropriate care, there's the importance of taking your health into your own hands. What can you do for yourself? Whether that's taking care of your sleep hygiene, your diet, researching your own stuff. Like PubMed is free. Like you can access most papers on there for free. And if you've been diagnosed with something or have a certain symptom or dealing with the potential root cause, you can look that up yourself. Like there's so much available resources in, world now and on the internet.
And it's very important.
It's very important, and being able to understand that will not only help you make better decisions, but it will also help you advocate. Like a lot of the problems I had, they were very related. And so when I, learned about one problem, I would be like, oh, like this seems to be related to this. And that's like a comorbid condition. Mm-hmm. And so then that led to being able to get treatments that helped me at the time.
And you found it faster than any doctor.
Oh, yeah.
Put two and two together.
The amount of time doctors can spend and vets can spend with patients is pretty limited.
Yeah, it does help if the owners come in with some knowledge of their pet's condition and some idea of which direction they want to go with it.
Exactly. Yeah. And sadly, like there's just not enough time. So if you can, spend that time yourself, that can be really helpful.
Absolutely.
So I think that's really important.
Talk about maybe like your sort of experience using intuitive guidance versus logical guidance in directing your care.
Oh, that's a good one. I have dealt with a lot of dissociation, which is kind of an interesting place to start, but being so disconnected from my body,
literally your head and your body weren't connected.
Exactly, they weren't. And so I was dealing with so much
like mental.
Yeah, I was like 100 miles away. Like I saw, actually, like I've since been told that it's actually not dissociation, it's actually depersonalization, which is like when you think you kind of view your life from like a third perspective.
Okay, and that happens when somebody has like a severe illness in general or your condition specifically?
For me, it was actually unmanaged chronic pain. Okay. I was in severe chronic pain and I wasn't getting appropriate pain management.
So you kind of like checked out.
I checked out. And then whenever I'd try coming back, I'd be like, oh my gosh, I have so much pain. I don't want to be here. Let's leave. And so it was quite effective for pain management, but not a great way to live your life.
Yeah.
And so when I was at my sickest, that was difficult because tuning into your intuition, you have to be in your body. And if you're 100 miles away, it's going to be difficult. So at my sickest, I think I definitely relied on more of the research logical side more because of that disconnection. I don't think when you're not here, it's not the best to rely on it. It's not as strong. Mm-hmm. I did have a lot of faith though, and I was willing to, believe that I'd get better. Mm-hmm. And then as I started getting better, and like after my surgeries, I had my neck and back surgery, and then after that I was like, oh, okay, I'm starting to come back into my body. And that's when I started using a lot more of the intuitive side, just because it was finally more available.
Mm-hmm. So what's an example of how you used your intuitive to guide your healthcare?
I think one thing would be there was a point where I stepped back from a lot of treatments. Like after my surgeries, I really did not get much medical care for about a year and a half, 2 years even, just because I was burnt out. And also I intuitively was feeling like that my identity was kind of tied to health, and stepping back would help me and help me build my own life that was separate from sickness. And it paid off. I've been doing really well, and I think now that intuitive side can come in more. I've been dealing with some minor health problems in the last couple of years, and that intuitiveness can come in when, deciding on a supplement or a medication, like, does this feel right? And sometimes they don't. And being able, like, I can even hold supplements or medications and feel, does this feel right?
Like muscle testing, basically.
Almost, yeah. But I usually go a little more internal into intuition. But yeah, you could literally muscle test too. That would be a great option. Also, sometimes when being, diagnosed with something, or a doctor is telling you something's the problem, you can go in and say, does this feel right? And
does that resonate with you?
Does it resonate? Yeah. And I think sometimes the answer is yes. And it's like, oh my gosh, that's how it was with my neck. It was like, okay, this ties everything together. That's what's actually causing it. And, we could go from there. Yeah. And sometimes some doctors would tell me things and I'd be like, it doesn't feel right. And it's been pretty accurate down the road. Those things weren't accurate. And
yeah.
I also think that can be appropriate when, choosing your treatment, even beyond medications and supplements. Does this feel right? And, that's kind of what led me to my surgeries and taking a more aggressive route. And I'd say it also applies a lot with pets. When you're choosing a treatment for your pet, because you don't have your, own body to check in with, you do have to rely on the intuition of, is this right for my pet? And also when going through diagnostics and treatment, and is this, what's actually going on?
So it's quite a remarkable health story and health journey that you've been through. I imagine that, and I know because I was there when you were going through it, that you can get, or you did get, very kind of burned out on doctors, and not just being sick, but just going to doctor's appointments, the money, the supplements, the meds, just managing all of that, and then trying to survive and eat well and all of that. How did you get through that, or how did you manage that level of burnout?
Yeah, it was definitely exhausting. It was extremely overwhelming, and just didn't want to see another doctor ever again, it felt like. I think the first step is pulling back to the degree that I could. At that point, my health was pretty good. I did not need to be seeing doctors as much.
Once you had your surgery?
Yes, once I had my surgeries, and I was pretty well. And so, I did pull back. I, only went to the appointments that I felt like I really had to. I even kind of pushed out some ones that probably would have been good to go to sooner. Yeah. But I did what I could that was kind of a maintenance level. I kind of maintained where I was, and then from there, I also focused on building community and deepening my connections, building stronger friendships, and deepening those family relationships. And then with that community, I was able to then go back and kind of focus on some minor health problems that I still had, and feel comfortable advocating for myself because I had that basis of support, essentially. And so, yeah, I'd say the basis of support, and then also just pulling back sometimes.
Taking a break.
Yeah, sometimes you don't have to go full ahead.
When you reach a point where you're not in a full crisis,
yes,
you can just take a break and say okay, I'm just gonna.
Yeah, I lived years in a crisis though, and so I was very burnt out. It was, all I did was doctor stuff, so
it's a lot.
Thankfully, I was able to take that later. Yeah.
Good.
Yeah, one thing I have a question for you would be, is we talked about the intuition, and the intuition of knowing what is, right for treatment, what's possibly even wrong. How do you recommend pet parents go about advocating for their pet when they feel something is off, but they don't really know what it is. They just seem a little off. I know when I worked for you, I'd hear that phrase so much on the phone. Something feels a little bit off. And I'm like, I can book you an appointment, but I don't know what to say. Yes. So
well, it's hard, obviously, because the animals can't talk and they can't tell us that the back hurts, that they're nauseous, or they have a headache. So we are a lot of times in a guessing game. Both the pet parents and the veterinarian are in a bit of a guessing game. So it is harder in the veterinary space, but just looking at little subtle details like appetite, activity level, mobility, heat or cold preferences, stool quality, is there any vomit, any, neurologic symptoms, or, anything like that. Those are really the pieces that we have to go off of. And then we have to use our Western diagnostics, and as well as our intuition and our basis of knowledge and experience to kind of lead us down a path. And it is harder for sure. Yeah. But a lot of times owners know, they know when there's something off, and a lot of times they find it before there's really symptoms, or they know before there's really obvious symptoms. So we have to, really honor that as veterinarians.
Yeah. I'm glad. I know you always did a good job doing that.
Oh, thanks.
I was always like, oh my gosh. It's hard because
hard.
You don't see anything going on. Like, it's just something's a little bit off. Like, what do you even do?
Yeah.
So,
yep. It can be hard.
Yeah.
So yeah, I think when pet owners have that feeling that something's not quite right, obviously just having a conversation with the veterinarian, but also trying to just absorb as much as you can at home with their behaviors is the best you can really do.
Amazing.
And then I think that, it's probably important to talk about, let people know that there are, you were mentioning to me earlier that a lot of bigger hospitals have health advocates, people that you can actually utilize that are there to support you in your health journey to help you navigate the healthcare system. Do you know much about that? Or
don't know a ton, but like you were saying, the larger hospitals often do have patient advocates. Okay. And so you can go and request one. They will have someone who will talk with you, who will, attend appointments even and advocate. So if you're dealing with something and you don't have the mental energy to advocate, or even physical energy to advocate for yourself,
or just the medical knowledge to understand what's going on.
That too.
The people rely on family members, but if you don't have that to, help you navigate, then that is available.
Yeah, and if possible, like if you have family and friends, like even if they don't have medical knowledge, like having someone there can be really helpful, especially when you're dealing with the overwhelm of, a doctor appointment, because that can be a lot to deal with.
And we have that on the veterinary side. Sometimes with especially elderly people, it's really helpful to have a family member come and attend the appointment so that, if information gets missed or miscommunicated, there's a third person there to kind of help wrangle in the information and keep it all coherent.
For sure. Yeah. I remember that a lot. Yeah. There was some benefit.
Yeah. Awesome. Well, thank you for sharing your story, and it was great chatting with you, and I'm so glad that you've made it to the other side on your health journey and gonna rock it now.
Yes.
Ready to rock and roll.
Yeah. And as kind of a final last message, I would really, besides advocating for yourself, just recommend having that faith that your life can be different. You can have a better life. You can be well. And even if you have a severe condition that's chronic that you don't know the cause of, there is a way. And having that belief that you will get through no matter what can be extremely helpful. One thing to kind of nurture that I found helpful was reading success stories, reading stories of people who got better despite the odds. And, there's a lot of support groups that can be helpful. And mind-body connection is always a theme that comes up, right? Exactly. And the quantum field work that you can do. Energy frequencies, positivity, all of that stuff is so important. Yeah, and being in that belief that you can get better will really help. I agree. That belief, coupled with the being really organized, taking the autonomy over your life, and just, speaking up will kind of come together and can get you through a hard time and get your pet through something. And yeah, so that would be my
Great advice.
Yes.
Well, thank you for being here, Katerina.
Yeah,
we appreciate you.
Thank you for having me.